Hi, I'm Ruth Karron, the director of the Bloomberg School's Center for Immunization Research and the Johns Hopkins Vaccine Initiative, and a professor in the Department of International Health.
And I'm Christine Grillo with the Johns Hopkins Public Health magazine. Dr. Karron has offered generously to speak with us today about the H1N1 swine flu and the vaccines that may prevent it. There seems to be a lot of concern, a lot of talk about the supply of the vaccine in the fall and the demand that will happen around it, and a lot of talk about chicken eggs. And I wonder if you could give us a quick lesson in how the vaccine is manufactured here.
Sure. Well, it was first discovered in the 1930s that you could grow influenza viruses in fertilized eggs. And these viruses are grown in the allantoic cavity of the eggs, and a small hole is drilled into a sterile egg, and then the virus or vaccine is injected. That's how we currently manufacture vaccines for use in the United States. Then that fluid is harvested and the virus is inactivated for inactivated virus vaccines and purified and then standardized according to the amount of one of the particular viral proteins, the viral hemagglutinin. So it's standardized according to how many micrograms of that hemagglutinin is included in a vaccine.
And when we manufacture from inactivated viruses, how many vaccines do we get per egg?
So typically, we would get less than 5 doses per egg. That's of a monovalent vaccine. If we, a typical seasonal flu vaccine that has 3 different viruses in it, it's actually only 1 to 2 doses per egg. So really relatively few. We have in the U.S. taken a lot of measures anticipating a pandemic. We've done a lot to think about vaccine supply, and so we've really done 2 sets of things. One is to actually increase our egg supply, because as you can imagine, if you don't have enough eggs, then you can't readily scale up your vaccine production. But we've also been looking at cell culture as an alternative method for manufacture of influenza vaccine.
Okay, I'd like to get back to cell culture in a moment, but can you tell us the difference between an inactivated flu virus and a live flu virus?
Sure. So an inactivated vaccine, as I mentioned when we were talking about production, is a vaccine. It's killed, essentially. You take the virus out of this allantoic fluid, you purify it. There are a few different purification methods, but you certainly purify it in a way that will preserve the influenza hemagglutinin and neuraminidase, which are the important protective antigens that you want to include in a vaccine. And then you purify it and it's killed, and that vaccine is usually given by shot, and then you look for an immune response. A live virus vaccine has to replicate in order to induce an immune response. And in the U.S. currently we do have a licensed live flu vaccine called FluMist. It's manufactured by MedImmune, and it's given via a nasal spray. So it replicates in the nose and it induces an immune response that way.
Okay. And in terms of production of live versus inactivated, the live is much more fruitful per egg?
Yes, you can get, because you're allowing the vaccine virus to replicate in people in order to induce an immune response, you need much less of it, in fact, than you need of the inactivated vaccine. So you could get probably hundreds of doses per egg as opposed to 5 doses or fewer from an inactivated vaccine.
In Europe, there's a product called FluAd, which is a vaccine made with an adjuvant. Mm-hmm. And I'm wondering if you could explain to us about adjuvants.
Sure. So an adjuvant is essentially a helper substance. It augments the immune response. And in the U.S., we do have the only adjuvant that's currently licensed for use is an old adjuvant called alum. It's basically an aluminum salt. And we use that typically with childhood vaccines. So a lot of For example, our DTaP vaccines have alum, so a lot of our inactivated childhood vaccines have alum in them to help with the immune response. We don't currently have an adjuvanted influenza vaccine. The Fluad vaccine, which is manufactured by Novartis, which is licensed in Europe but not licensed here, has what we call a novel adjuvant, and we call novel adjuvants anything other than alum. And their particular novel adjuvant is something called MF59, which they have used. So Fluad's been licensed in Europe for a number of years and is used particularly in the elderly and in some other patients that might be anticipated to have a less robust antibody response, like dialysis patients, but who still need to be vaccinated against flu.
You mentioned cell culture technology as an alternate to chicken eggs. Could you tell us about that?
Yes. So, as I mentioned before, eggs have their limitations, although you can certainly scale up production. There's a limit to how much you can do that and how rapidly you can do that. Obviously, when you're growing vaccines and cells, you can scale up production much more rapidly. And again, there are a couple of companies that have flu vaccines produced in different cell lines that have their vaccines licensed in Europe. And it may be that over time we also will have flu vaccines produced in cell culture licensed in the U.S., but we don't currently.
Could you expand on adjuvants?
Sure. So I did mention one vaccine that you had asked me about, the Fluad, that has an MF59 adjuvant. But there are other companies that are also producing vaccines with novel adjuvants. For example, GlaxoSmithKline has a variety of different novel adjuvants that they're using. And it may be that we, in the future, see a licensed influenza vaccine made with novel adjuvants. And the advantage of that, particularly when you're thinking about a pandemic, is related to what we call dose sparing. So ultimately, the idea would be that we would think globally, and we would like to prepare vaccines for the world and not just for individual countries. And although I think our global capacity has increased tremendously in the past 5 years, we still don't have enough vaccine to immunize the world. Using novel adjuvants would allow us to potentially stretch our numbers of doses of vaccine by including less of the flu virus in our inactivated vaccines than we would with unadjuvanted vaccines.
Dr. Karron, are there any radically new vaccine approaches on the horizon?
Mm-hmm. So one approach that I think is just worth following is an approach of, typically, our current vaccines are either the live vaccines that we've talked about or the traditionally either grown in chicken egg or maybe someday grown in cell inactivated vaccines. There are a couple of new technologies worth keeping our eyes on. One of them is production of what are called virus-like particles. And people may be familiar with those because it's actually that technology that we use to make human papillomavirus vaccines that are already licensed. But virus-like particles are essentially, you think of them as empty viruses. So they can't replicate, but they have the influenza, hemagglutinin, and neuraminidase on their surface. They're also you can produce, because of the techniques used in manufacture, you can produce a lot of these with in very small manufacturing plants. The footprint of the manufacturing plant can actually be very small to produce millions of doses of vaccine. So that's one thing to watch. And I think we're certainly, I don't think, close to this yet, but the holy grail for influenza vaccine people is a universal influenza vaccine. What if we had a vaccine that would protect against all of the strains of influenza? and not need to be changed every year or in the event of a pandemic. That would be wonderful, but I think we're a ways away from that.